not seen, well, we've seen some cursory bills, but the fact is we've seen the record of what's happened in the last 6 months. We will, if it's like anything else, like we've done with tax and trade and the so-called stimulus package, we will not see the bill, and if we do, we'll only see it within hours in the dark of night. Frankly, right now, there are still forces that are looking at doing this. I sense this is another one of those situations, as stated by the President's Chief of Staff, that they are looking to exploit a crisis. The great battle cry of the Obama administration has now become, let no crisis go unexploited. I think people are getting pretty cynical and getting very concerned about how far into debt Congress is putting future generations. And we're talking trillions of dollars being passed without members of Congress even being allowed to read a document. We just had supposedly an environmental bill that had huge tax increases in it, wasn't even allowed to be read. It actually hadn't even been put together before the vote was forced. I think that healthcare, saying that you're going to put it together within a few weeks is absolutely irresponsible. We're talking about a program that means life and death to our constituency. We don't only have a right, we have a responsibility to read it, study it, and know it before we're asked to vote for it. We don't want to see with healthcare a kind of mistake we saw with the so-called stimulus bill. There are a lot of people around here that know the AIG pay raises were stuck into a bill and they were passed because Congress wasn't allowed to read it. I don't think the president should be dictating how laws are passed in this country. That's why we have members of Congress and direct representation, is to represent everybody, not just the administration. Well, I think we're looking at a major cost increase, and we've already got the Congressional Budget Office just came out and said costs will not be reduced as the president asked us to do. They'll actually be expanded. So healthcare costs will be increased. The only thing that will gain in this is the fact that Washington will be able to pick winners and losers, much like what they did with the bank bailout. And it's about consolidating more power under the federal system, increasing the footprint of the federal government in our lives. And that is a major concern. If they really want to be serious about this, the first thing they could do is eliminate the tort cost that's directly related to health care. That means $700 for each American citizen that we could be putting into health benefits rather than paying it out to the trial lawyers. If we want to find consensus, bipartisan consensus on health care, maybe we should start by reducing the profits of the trial lawyers and the insurance companies, but not do it in a manner that says Washington wants to make everybody fit into one size. You've got to remember, we're talking about a system that will be as big as 350 million. When they talk about France or they talk about Canada, Canada's just the population of California. It's about 30 million, 35 million. We're talking about a system that is larger than any other health system in the world outside of the Soviet Union. And we all saw what happened to the Soviet Union. Well, my mother's side of the family is from Australia. I know exactly what socialized medicine looks like. I've lost 2 cousins to skin cancer because under the government system, it took 2 years to be treated for skin cancer. Both of them passed away. I've seen what my mother's family has gone through, and I don't want my grandchildren to inherit a system like that. Well, I think there's going to be a great alternative plan, but it's going to be, we need to do some fundamental changes. We've got to say that get the trial lawyers out of the operating room is one of those. We've got to take a look at where the money's going to come for research. We've got to talk about encouraging people to invest in healthy futures, both from the research point of view and the personal responsibility. In so many ways, we've got to look at prevention, and one of the keys of prevention is to do with healthcare what we did with welfare, and that is require the individual to be responsible for their own well-being rather than smoking, drinking, not worrying about managing their weight or their blood sugar, and then asking the taxpayers to bail them out and pay for the cost of their irresponsible individual action. I think we got to start asking people to understand that personal responsibility is where health begins, not Washington, D.C.